I'd like to introduce my audience.
Stephanie,
Brooke,
Sharon, Kim.
Hi, my name's Alyssa, and I would like to convince my audience that breastfeeding a baby is better than bottle feeding using formula. For the women in the audience, by a show of hands, how many of you have chosen to breastfeed rather than feed your child using a bottle and formula? Now for the men in the audience, how many of you support the choice of breastfeeding for your partner? I am an up-and-coming mother and have read numerous articles and books about the benefits and health factors that come out of breastfeeding rather than using formula to feed your baby. Many new mothers struggle with the decision to breastfeed or bottle feed their new baby. According to a Surgeon General report found online at kidshealth.org in the online article titled A Personal Decision in 2011, some 64% of American women breastfeed during their infants' first weeks to months of life. That's better than the 50% who breastfed a decade ago, but it missed the government's goal of having 75% of mothers breastfeeding newborns in the year 2000. There are 3 advantages of breastfeeding. The first advantage is that breastfeeding is more cost-effective. The second advantage is that breastfeeding is more beneficial for the mother. And the third advantage is that breastfeeding is healthier for the baby. Now let us begin with how breastfeeding is a cheap and inexpensive way to feed your baby. Breastfeeding is cheap and less expensive, which brings us to our first advantage. Using breast milk is a far more inexpensive way to feed your baby rather than using a bottle. There is absolutely no need to go out and spend money on formula products or even bottles to suffice the baby's hunger. Also, you can freeze and refrigerate breast milk longer than you can when using formula, which allows you to save it for another feeding time. Breast milk is all natural and does not come in a box or carton with an expiration date. According to the writers at kidshealth.org in their article in 2011 titled A Personal Decision, breast milk includes the natural DHA and ARA polyunsaturated fatty acids, which are considered the good fats, that may be linked to brain and nerve development. Many infant formula products try and match the ingredients that are found in breast milk, which causes them to be expensive. The unknown writers at kidshealth.org in their article titled A Personal Decision in 2011 also state that some studies have indicated that formulas supplemented with DHA and ARA formulas benefit visual and cognitive development, but others haven't seen any significant improvement with DHA and ARA formulas. It has also been said not to buy formulas from damaged containers, as they may potentially harm your baby due to possible contamination from the outside. These cost-effective advantages are what bring us to the beneficial advantages for the mother. Breastfeeding has many beneficial and wholesome advantages when thinking in favorable terms coming from the mother, which brings us to our second advantage. When a mother chooses to breastfeed, it becomes more convenient for her and the baby. The mother has breast milk available anytime and anywhere. The unknown writers at kidshealth.org in their article titled A Personal Decision in 2011 also state that breastfeeding is economical. There's no worry about having to sterilize and warm bottles, the right formula to buy, or how to prepare it. Breastfeeding allows the mother to lose a lot, if not most, of her pregnancy weight gain. Mothers naturally burn calories to make breast milk every time they nurse. Medical Dr. Newman states in his message titled Starting Out Right, found in the Journal of Breastfeeding in 2011, that the fat that is deposited during pregnancy and used as a reserve for lactation is easily used up if the mother nurses for a significant amount of time. Breastfeeding also has many positive after-pregnancy effects that benefit the mother. Breastfeeding delays menstruation and postpones fertility. Breastfeeding also enhances the contraction of the uterus and helps it return to its normal pre-pregnancy state more rapidly. Now that we have covered all the benefits and inexpensive aspects for the mother and the family's income, let's discuss how these advantages can lead to a healthier lifestyle for your baby. Breastfeeding is much healthier for the baby than bottle feeding with formula, which brings us to our third advantage. The contents found within breast milk can greatly benefit the baby pertaining to their health aspects. Hirsch states in his 2010 article titled Breast versus Bottle Feeding for Your Baby, found in the Journal of Health and Baby, that breast milk contains active infection-fighting white blood cells and natural chemicals that give increased protection against infections in the first month, when these can be the most serious. If you look on my visual aid, there is a comparison between the intestine of two infants. One infant is being breastfed and the other is being fed by formula. Bacteria is adhering to the milk fat globules which prevent infection in the breastfed infant. Now in the intestine of the formula-fed infant, bacteria is adhering to the infant's mucosa, which causes the initiation of infection, and we see that starting right here with these blue specks. Hirsch also states in his 2010 article titled Breast versus Bottle Feeding for Your Baby, found in the Journal of Health and Baby, that breast milk contains the perfect proportion of nutrients that your baby needs, including proteins, carbohydrates, fats, and calcium. Dr. Newman explains in his 2010 article titled Starting Out Right, found in the Journal of Breastfeeding, that breast milk travels through the baby's gastrointestinal tract very quickly, which allows it to be easily digestible. Breastfeeding can improve the outlook of a baby's health in the future. Hirsch emphasizes in his 2010 article titled Breast versus Bottle Feeding for Your Baby, which is found in the online journal titled Journal of Health and Baby, that breast milk can protect against allergies and asthma in the future, as well as decreasing your baby's risk of becoming obese. The authors at womenshealth.gov, in their book article titled Breastfeeding in 2010, state that breast milk also contains fatty acids that help promote brain development and can improve cerebral functions. All these aspects are advantages and facts that state the truth behind breastfeeding and why it is ultimately the better choice for you and your baby. There are 3 advantages of breastfeeding. First, I covered how breastfeeding is more cost-effective. Second, how breastfeeding is beneficial for the mother. And third and finally, how breastfeeding is healthier for the baby. When it comes time to choosing the method for feeding your baby, it is ultimately up to you and the way you feel what is best for your baby and your child. Just take into consideration the facts about breastfeeding over using infant formula, including its benefits, health prospects, and money saved in your wallet. The American Academy of Pediatrics, or AAP, state online at kidshealth.org in the online article titled A Personal Decision in 2011 that it is better to breastfeed your child exclusively for the first 6 months. Beyond that, the American Academy of Pediatrics encourages breastfeeding until at least 12 months beyond that. The choice is yours, so choose wisely. Thanks for watching.